To take our roll call attendance. So please, when you hear your name, stay if you're present or not present.
So just hold on 1 second. Thank you so much. Tell you. My husband doesn't give me coffee.
It's on tape. It's on tape. Be careful. I told you that's on tape.
Robert Winchell,
Here.
Joseph Schenker,
Here.
Michael Batch, Robert Ackerman,
Here.
Nicholas Alexandru, Christopher Graziano,
Here.
Eric Cohen,
Here.
Mimi Langsam, Kevin Munjal, Cindy Basilos. Here. Dario Gonzalez.
Here.
Glenna Seda.
Here.
Bradley Kaufman. Doug Isaacs. Nathan Reisman. Reisman. Gotta mess up at least one name. Joshua Buckley.
Here.
Allison Burke. Jeffrey Rabridge. Heidi Cordy.
Neil Fulmer down
Neil.
for Heidi Cornish.
Louis Marshall. Michael Redlener.
Here.
Michael Hilton.
Here.
Pamela Lai. Dominic Battinelli.
Here.
Scott Chang.
Here.
Peter Wire.
Here.
Paul Barber.
Here.
David Benelli.
Here.
Celia Quinn. Timothy Stiles. Charles Martinez.
Present.
Joseph Bove. Martin Grillo. Matthew Harris. Matthew Harris. I'm sorry, it's here. William Fisher.
Here.
Robert Krupe.
Here.
Jessica Van Voorhees. Arthur Cooper.
Here.
Yadidra Langsam.
Here.
Anthony Shalish. Christopher Sorrentino.
Just going to verify that we have a quorum, and then we will move forward.
Yep, we have a quorum.
Right. Excellent. Okay. First, I'd like to ask for approval of the minutes for the January 23rd meeting. Anybody have any questions, comments, changes, concerns? Hearing none, I will accept those minutes. Correspondence report. The REMAC has received a letter from Greater New York, which had two items on it. First is Laura, I'm going to mess this, Ivacoli, to fill the seat of ED administrator, and Dr. Stuart Kessler is going to serve as an alternate for Dr. Ivacoli. These are nominated seats, these are appointed seats from Greater New York Hospital Association. So unless there is an objection or a concern, these people will be accepted into our membership. Any questions or concern about Laura or Stuart? Seeing none, I'll move on.
Excuse me,
Yes.
just know that must get submitted to REMSCO for approval.
Okay. Greater New York Hospital Association also nominated Dr. Neil Flomenbaum to serve as an alternate to Heidi Cordy as the ambulance service medical director seat. At the last meeting, there was a appointment, or there was a letter submitted by Dr. Tepperman for Dr. Berry to be to fill the seat of the HHC physician. There was a bunch of questions after the meeting, which I want to clarify. Dr. Tepperman does not have the authority of HHC to give that seat. That would fall on either the CEO or the CMO of HHC. Dr. Michelle Allen is the CMO, and we are waiting for correspondence from her as to who will be filling that seat. We might get it during the meeting, so if we do, we will discuss that as well. Again, all of these have to go to REMSCO for approval. Okay, so next, there are no public notice to report. Greater New York also introduced Andy Colarusso. Ms. Colarusso is from City Hall. She was charged with an initiative to reduce noise pollution with a focus on sirens. She thinks sirens are bad, apparently. She will work directly with city agencies and Greater New York Hospital Association will work with her regarding hospital-based agencies. She would like to discuss this agency with volunteer EMS via REMSCO, REMAC. I guess we will invite her to a future meeting.
The state has certain regulations about when sirens must be
Correct,
used.
correct. But we can invite her to a meeting to make her point. We can all ignore it after, but we have to at least listen.
Well, she's lucky she didn't come tonight.
Okay. So the Office of the Council also sent out the following correspondence. So the agendas were sent out. There were 2 advisories that were sent out. The REMAC advisory for modified start triage, as well as a REMAC advisory for syringe epinephrine for basic EMT. Those were both sent out. And a draft advisory is available to REMAC, which we're going to discuss in a few minutes. Okay. Subcommittee reports. So the executive committee met last week via telephone call. Myself, Dr. Kaufman, Dr. Rabrich, Nancy Benedetto, and Marie Diglia were on the call. And the call was to discuss an initiative that is being discussed and pushed forward by the Department of Health to leave these Narcan overdose prevention kits. It's a leave-behind kit. It comes in a blue packaging. It has a Narcan dose in it, as well as some basic airway and glove and PPE type of supplies. This is the kit.
It has 2
Um,
doses.
It has 2 doses of the nasal Narcan,
4 million.
4 milligram Narcan that we approved in the region, as well as a face mask, some gloves, and so on. So the region has prepared an advisory to send out, which was sent out to the REMAC as a draft, to basically work with the Department of Health to make these kits available to our EMS agencies. For the purpose of giving to a patient whom, after a dose of Narcan, chooses to RMA. Obviously, these RMAs will go through appropriate medical control, but in the event that these patients are RMA'd, that they would be getting one of these leave-behind Narcan kits to have at home. Any discussion? The draft was sent out. It was written as a draft before REMAC met because of some questions and discussion from City Hall. They wanted to see what REMAC's support would be, so the draft was prepared. Glenn, you want to say anything more about this?
Sure. 2 Wednesdays ago, so 2 weeks ago, City Hall contacted us that the mayor is very interested in having this leave-behind Narcan kit. Left behind by ambulance personnel. As part of the city's fight against the opioid epidemic. One thing that the mayor did announce at the State of the City address was that the city is suing Big Pharma. He didn't mention this program particularly. I think he realized that it still had a way to go. He also didn't mention some of the clinics that have been in discussion about how they do it in Canada, where people will go and, in a controlled environment, use the opioids. But anyway, so we were contacted by City Hall, the mayor's office, and there were initial discussions. I wasn't familiar, but I was trying to figure out how is this even possible, leaving medication behind. My concern initially was the dispensing of medication, which we've never done before. But in my research, I found out that there is a state program since 2009 called the Opioid Overdose Prevention Program, OOPP. And it's a state program that you can apply to or register to. And I also found out, because initially we're trying to find out the cost of these things, and we looked at, for the RMA cases, probably about $48,000 that we were looking at having to spend. which is a small amount, things. Again, mainly for the RMA patients, because those are the ones, the statistics have shown that they tend to overdose again and they have worsened outcomes, so we want to be able to at least leave a kit with them. So there is a program already. If you apply to or register with the state's OOPP, you actually come under the city, New York City DOH's program. And I went on the website and took a look, and some of the instructions are a little confusing under their program, but ultimately there are 400 sites currently that are under the New York City program. And it includes public safety, hospitals. Quite a few of our hospitals are already part of their own OOPP programs. As well as, it was interesting to me looking at the list, in Brooklyn, Flatbush Shomrin Public Safety Patrol. New York City Amtrak Police are on this as well. Now, I know Amtrak Police is law enforcement, but there are different subcategories. And so these folks are leaving these kids behind, and they don't have essentially any medical training. So in looking at that, the other benefit is under the city's program, they'll provide you with these kits. So any agency that registers and goes under the New York City DOH program will get these kits. The only caveat is that apparently they ship you just the pouches, just the nasal Narcan. You have to actually put it together.
Can't put it together.
Right, so you're putting it into a bag. And REMSCO is also an OOPP.
REMSCO is an OOP, and we
Right.
distribute it to all of our EMS agencies, excluding the fire department. At that time, that doesn't mean that we might not be able to do that now.
Right, and City DOH has said to us that if we register, we can obtain
Yeah.
those as well.
So we are registered.
So there is some language that was confusing to me under their website, something about a trained provider, but it excluded EMS providers that already can administer, and I thought, wait, that doesn't make sense. I tried to speak to our legal, they gave me an answer that didn't make sense to me. So I actually spoke to the director of the city's program, and essentially the trained provider is the person that actually is given the kit. So you're supposed to actually give them some training as to how to identify an overdose and then how to leave these kits and things. Now, one of the issues for us is that we can't do anything that prolongs our on-scene time. City Council has been kicking our butts really and trying to reduce the scene time, so if we're there for any prolonged time. So City DOH said that they would contact the state. We might be able to actually, if you have a good enough instructional sheet, actually leave it with that person or the family. Our thought initially was that we would go with the RMA patients, because those patients that are being transported are going for further medical care, and a lot of these hospitals are OOPPs to themselves, so they could provide the kits, they can provide the rehab information and such. So that's where we kind of looked at it. We were given photos of this kit. This is the first time I've actually seen one in and of itself that Nancy was able to bring down. The other concern I had is it's 4 milligrams and 4 milligrams. So that's double the dose that our medics can actually give, right? 4 milligrams is the max. But we would actually never be administering that. It's the kit that actually goes out. We wouldn't be using any of it in there. And again, some of these, the pharmacies that actually have it over the counter, they have to register as the OOPP as well. So it's not a new concept. And this is something that the mayor is really pushing for. Now, initially, he didn't, the concept that the 911 system was not just the fire department was something we had to explain to them. And so he wanted to potentially go forward to City Hall, and we said, you have to realize that only 2/3 of the 911 system are fire department ambulances. So if we were to do that, it would be 2/3. We had to wait for his word that would be okay to start with. But subsequently, the advisory, initially I'd asked for a letter of support. The advisory actually includes that if available, that essentially it's the entire 911 system. So that's the program in a nutshell. There's more details that you can get on the website as well. And the kit you can take a look at as well.
May I add something?
Sure.
And so I'm working with the City Department of Health to put together, in addition to those kits, a listing of treatment sites where we may be able to include that in there, which would assist those RMA patients, as well as the directional sheets that you were referring to. So we may be able to have that all together by the time we have you registered as well.
Can I just make a suggestion,
Hold on.
maybe for the directional sheet? If the city could maybe make a video that could be posted online so that people, at least, obviously not in the moment if someone's overdosing, but it's something they could use to review signs of overdose. What do I do with this medication? How do I use it? That may help with the education piece for the lay public.
Sure. hold on a second, Art, and then David.
Yeah, I was just looking at this kit, and the photographs, or not photographs, but the images on the front of the pack don't match the actual
That-
equipment that's inside the pack.
That's correct.
And that's a
The-
problem.
No, the new, that was just to facilitate bringing it downstairs into a blue kit. The new ones did not arrive
And the pictures on the front will
yet.
be the same as
Because
what's
of the
inside?
difference of the the nasal spray.
Okay.
Yeah.
Yeah,
Sorry.
initially it started not
It
as a
started,
spray.
right, exactly.
I think it was an IM injection. And the city has told me that they,
I just was putting it in the thing so you'd have a blue bag.
and the city's reported, when I spoke to them last week, that they've distributed 120,000 of these kits.
Great,
Wow.
So I just have to get the new bags are on order.
okay, yes.
My question is, does anybody know if there's any data on efficacy of this? I've certainly resuscitated enough people who have a little fanny pouch that looks just like this, to know that there are plenty of people who either are not able to administer this to themselves, or don't have somebody who knows how to use it nearby, or just didn't get to it in time. I mean, I think, it's great to try and save some lives. I just wonder if it's effective, or if this is more of a, kind of a political stance to say, look, we're doing everything we can to stop this problem.
Good question. Paul?
Similar thing, I think this came up with the 4 milligram, 2 milligram thing, issue. The 4 milligram provider naloxone, maybe it's a lay person providing it. We say that we stand behind our EMTs and paramedics as being trained healthcare professionals. That line wasn't very clear with the whole 4 milligram, 2 milligram thing. These are the kits, these is what you got, and the public is using them, so you should use them too. There is a distinct difference between a provider and a lay person. I don't know if that has anything here, but again, it seems like everything else becomes, we have to do what's going on as well.
I just like my experience with patients. A lot of times they've been opiate users for many years, and a lot of their family members kind of know what's going on. And if you just maybe direct them to a training video, because I don't think the EMTs, like we were talking about the on-scene times, they're not gonna have time to sit there and train them, but a lot of them have experience. I think it's just something, it's better than nothing. Maybe to speak to the political issue, it's better than nothing, and a lot of the family members do know what to do with this if they're recurrent overdoses.
Yes.
Just, we're gonna be dispensing these out of emergency departments also, and there's just a small amount of training that you need to do for the person that you're gonna give it to. The only other thing is we're gonna do instructions, hopefully in multiple languages. I guess you guys know, I'm very aware of that, what languages we need to do it. But we're gonna be doing these from the ED, and you can get this over the counter in a number of drugstores in the city, but I still think it's a really good idea.
Great. So again, the executive committee met to have this draft before the mayor's State of the City address on Tuesday, which is why the meeting happened before the actual full REMAC body. But I bring this to you guys because, in the past, the executive committee has done things, and I want to make sure that everything is transparent. If this body agrees, and I will take, this is not a protocol change, this is just an advisory, we'll just take a hand vote. But if everybody agrees to this, we will release this as not a draft, but as a advisory that we're willing to participate in this program. All in favor of sending this out, please raise your hand.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Anyone opposed? Thank you. Okay, so seeing that, the motion, this will go out as an advisory in the region. Medical Standards Committee, Dr. Benelli.
Medical Standards Committee met just before this meeting. There are two action items that are voted to vote to REMAC. The first one is changes to the administrative manual of the CNC committee. We reviewed those changes in detail. I'll let Dr. Barbara discuss them if needed. And that's what is second in motion for vote for approval to this committee. Would you like to review the changes, or I can?
So everybody received copies by by email.
Okay. Let's do further discussion.
Any,
There were some changes from what was sent out.
Yes, there's some little changes that Paul is gonna incorporate and send to Marie, that is correct.
But they're minor.
Do you want me to speak to the changes, Dario?
Yes.
If we're gonna vote on them for the people that weren't
this
there.
is gonna be a roll call vote because it affects the paramedics and so if that's the case, if you could read the changes that we've made so that everybody knows what we're doing.
Joe, please clarify. Read the changes in entirety or just the changes from the last
The
meeting?
changes in entirety, this is a protocol vote, it has to be on the record.
Okay, so yes, but whatever we're gonna put up there is not including the changes that we made in that meeting.
Correct, so the changes that were made in the previous meeting, which was right before this, just if we could please address those changes. David can't make it on the forum. Okay, how David about it? We weren't on the forum without it.
No?
Literally just had the number.
He left already?
He just walked out.
Who's that? Who's that?
Walked out.
He's not over.
We'll have to kill him.
He is.
We did.
I think they're on the quorum without him. Pretty sure he's on the committee. We'll double check.
He doesn't have REMAC movies.
Okay, good, then we're fine.
You're not voting member.
Perfect, then we're fine.
Remark Dr. Stiles as being present.
All right, great.
Oh, while we're pulling this up, I just want to make an announcement. We did get an email from HHC, from Dr. Allen, and her email stated, Dr. Amando Baez, who is the ED director at Kingsbrook, Kings County, I'm sorry, was nominated to the HHC seat, and Dr. Shrees Berry as his alternate. So that will go to REMSCO for approval unless there is any,
Who sent that? Sorry.
that was from Dr. Allen, who's the
Michelle Allen, she's the
CMO
CMO.
of HHC. H&E, helping out.
Not nice.
All right, Dr. Barber, whenever you're ready.
So the changes we have for the certification credentialing manual read as follows. Section 1.2 candidate requirements, 1.2.3 subsection A. Candidates not meeting CME requirements at the exam may test for provisional 6-month certification to complete their CME. The provisional exam is a one-time test and retest courtesy only. Multiple attempts at the provisional exam are not permitted. I'm going to remove section 1.8.2 as well. That was part of what we discussed in the last meeting. 1.2.3 subsection B. Candidates who provide proof of graduation less than 1 year from their paramedic original training program are considered to meet CME requirements. CME is prorated for candidates 1 year after graduation from a paramedic original training program. Section 1.3, subsection 1.3.4, letter C, exam fees are waived for participating regional course sponsor programs. The waiver applies to the independently scheduled REMAC basic exam date, not to the individual students. 1.4, exam registration. 1.4.2, subsection B, number 2. $100 registration fee by money order or electronic fund transfer to New York City REMSCO. 1.4.2C, repeated attempts at the basic exam are limited. After 2 consecutive failures, there is a 6-month preparation period before the candidate may attend the next exam. After the 3rd and further consecutive failures, there is a 12-month preparation period for the next exam. CME requirements are not waived due to mandatory preparation period. CME is prorated for candidates 1 year after graduation from a paramedic original training program. 1.5, exam admission, subsection 1.5.1, letter B. New York State Department of Health paramedic certification card, no on-site scoring results. Letter C, refresher candidates must present a CME letter from their primary service medical director. Medical directors must meet REMSCO requirements. Section 1.6, exam components. 1.6.1, a single multiple choice exam. 120 regional protocol questions with 4 choices, approximately A, 12% general operating procedures, B, 60% treatment protocols, C, 12% appendices, and D, 16% scenario-based questions. 1.9, candidate CME verification. 1.9.7, inactive status may be requested by currently certified REMAC providers unable to work in their capacity for reasons such as, but not limited to, illness, injury, or military deployment. Written requests are made to the REMAC Certification and Credentialing Subcommittee and reviewed on an individual basis. The provider does not have the required CME upon recertification. Approval of inactive status grants the provider a fee waiver for the REMAC basic exam and an extension of their REMAC certification for the time period they were inactive. The provider must then submit a CME letter from their primary service medical director before their extension expires for the full 37 months of certification. 1.9.8, candidates without any primary service medical director but who have met the CME requirements must submit their CME records to the REMAC liaison for pre-approval prior to applying for the examination.
I mean, we'll finish the whole thing and then I'll.
I did.
Okay, good. Any discussion, any questions? I mean, in reading this, the one question I had is where it says illness, injury, or military deployment. Does that mean that if you had a cold and you bring a letter from your doctor, that you have a extension?
About putting in the word significant.
Or a significant, maybe, yeah, I just think we need to clarify that, otherwise somebody's gonna bring a doctor's note saying, I didn't wanna take my test today.
I have patients all the time that think that the sniffles is significant.
College students doing this
So
all
I don't know
the
how we're gonna word this.
We can say prolonged injury or illness?
But,
Prolonged
Joe,
beyond
can I
2
go back?
weeks.
Sure.
Immediately following that sentence, it says written requests are made to the subcommittee and reviewed on an individual basis.
I mean, that's fine.
So it
I'm just
allows
saying.
for significance. I mean, we had a letter sent on behalf of a medic recently, and I just asked them, I said, how about the letter from the medic? Someone
look,
else is asking for inactive status for someone else.
I have
not the
no
healthcare
problem with it,
proxy.
I'm just suggesting that it's a little vague. And do we wanna be more specific? But if you wanna just put it on the individual basis,
Why
that's
don't you put the
fine.
word significant in? It'll still be the same thing, you'll still have your judgment.
Do I have to motion this?
Make an amendment. I'll make an amendment to add the word
Your
significant.
amendment is,
To add the word significant.
You can accept it.
I forgot my Robert's rules, but I think I should accept it.
Someone has to second it.
I'll second.
Now it's gotta be voted on, but okay.
We're just gonna vote once.
I have I mean, I think one counterpoint is, someone's gonna say, how can you say my injury is significant or not?
Yeah,
It becomes a workman's comp tribunal,
I agree.
and it becomes at my discretion potentially, so,
Okay,
Just, it's covered under review on an individual basis.
that's fine. Again, as long as everybody's okay with that, I'm okay with it. All right, so, seeing no more discussion, we'll just take a roll call vote to approve these changes.
Wait a minute, excuse me, Joe.
Yes, sir.
There is a motion on the table to amend, is that withdrawn or not?
I'll withdraw it.
That was withdrawn.
thank you, Dr. Cooper.
Okay,
Yes.
so
Good.
vote
Good job.
yes, no, or abstain. Robert Winchell,
Yes.
Christopher Graziano,
Yes.
Cindy Vasquez,
Yes.
I never pronounce it right. Dario Gonzalez,
Yes.
Glenn Esteta,
Yes.
Neil Floenbaum,
Yes.
Michael Redlener,
Yes.
Peter Wire,
Yes.
Paul Barbara,
Yes.
David Benelli,
In favor.
Timothy Stiles,
Yes.
Charles Martinez,
Yes.
William Fisher,
Yes.
Robert Krupe,
Yes.
Arthur Cooper.
Yes.
Dr. Spencer.
Yes. Okay. Dr. Benelli.
Okay, the second item that's brought, second motion to the REMAC committee is a proposal brought up by Dr. Zimmerman as we know, the New York City Fire Department has now changed, is now taking pediatric trauma patients to pediatric trauma centers up to 30 minutes transfer time. And Dr. Zimmerman has proposed, and Medical Centers has approved, to make that a regional standard.
Any questions?
Yes, just as a comment, it's a change in protocol, and it has to go into effect when change in the protocol is going into effect on the date.
Okay.
I would comment that I think it's really an emergency and something that should be done immediately. It's not just a simple change.
Then people have to vote, and it's an
And
emergency
we
protocol.
do have that option.
Yeah.
Can I just, this was already approved at the last REMAC meeting, so the change from 60 minutes to 30 minutes is approved. What you're voting on now is when to implement it into the system.
So, just to be clear, the state sent a undated letter to us from the STAC committee, not from the commissioner, stating that they recommend a transport time of 60 minutes, bypassing adult trauma centers to go to a pediatric trauma center with a pediatric trauma patient. At the last REMAC meeting, we had a discussion. The fire department, who manages the 911 system, felt that from a resource utilization perspective and with the amount of pediatric trauma centers, that 30 minutes was a more appropriate number in terms of accommodating the system. REMAC has sent a letter, which was sent on February 5th, to STAC, indicating that we as a body have agreed to the 30-minute transport time as opposed to the 60-minute transport time. The fire department has operationalized this already. So what we are discussing today is whether the entire system should operationalize it today, or should we wait until it is approved at the state, and then comes back to us and roll it into our regular protocol process. So the timing is really what is of issue here. The 30 minutes is what we've agreed upon already. Dr. Cooper.
First of all, it was never clear to me that this was actually protocol change. It seems to be, to me, more of a policy change, okay? The fact that, to the best of my recollection, it never actually went to CMAC and SEMSCO for a subsequent protocol vote suggests to me that it's more of a policy than a protocol. So I think some clarity on that is necessary. That having been said, I have absolutely no objection to moving forward with this, by this vote at this particular time. I think it's the right thing to do, as all of you do as well. But I think some clarity as to what it is that we're seeking to change here, whether it's a policy or a protocol, is necessary.
What speaks to it being a protocol is that the GOP language for transport decisions or transport, that section would have to be modified to include this language.
Understood.
That would be the protocol aspect of it.
Understood. I don't think the state ever intended this, the STAC or the department ever intended this as a protocol change.
Okay.
Acknowledging that, it sounds to me that the way you've presented the issue here is really a political issue. It's whether we do this now or wait for an official approval from the state. And that has nothing to do with GOP. That is a political decision on the part of REMAC, which I suggest be made on an executive level.
One other comment, Joe, if I might. If the fire department has already implemented this as their operational policy, and they're considering it a policy, I would suggest that, you know, for purposes of clarity within the region, that we, as a region, consider it our policy and implement it forthwith. And if they want to tell us no later, they can do that, but, you know.
Plus, it's probably the right thing to do to our patients.
Any further discussion? All right. Considering that the language in the GOP would have to be changed to accommodate this, we'll do this as a roll call as well. So please listen for your name from Marie as we go through this.
So, just clarification before we vote. Are we voting on this as a, to take effect immediately?
If the vote is yes, we'll change the language and send it out as an advisory to go into effect immediately, using the fire department's language as a blueprint.
And we will have to change the GOP.
The GOP, we just have to add a line specifying that pediatrics should be transported 30 minutes and so on.
So this would be an emergency change for that GOP.
Well, that's, again, we've already agreed to make the 30 minutes our rule. What we haven't done is said to do it today. So that's what the whole purpose of the motion was to make the change now.
Okay? Okay, yes, no, or abstain? Robert Winchell,
Yes.
Christopher Graziano,
Yes.
Cindy Beslos,
Yes.
I'm getting better. Dario Gonzalez,
Yes.
Glenna Seda,
Yes.
Neil Florenbaum,
Yes.
Michael Redlener,
Yes.
Peter Wire,
Yes.
Paul Barbara,
Yes.
David Benelli,
Yes.
Timothy Stiles,
Yes.
Charles Martinez,
Yes.
William Fisher,
Yes.
Robert Krupe,
Yes.